We're with Dr. Zahi Nasura, board-certified vascular surgeon at Providence Tarzana Medical Center. Dr. Nasura, stroke is a debilitating disease and it affects a number of people in this country. How can we prevent having a stroke?
Well, let me start by saying that stroke results from three different areas. It can be a result of the heart, it can be a result of the carotid artery, or it can be a result of something that's going on in the brain. Let me a little bit concentrate on the carotid arteries because this is where my area of expertise come in. The carotid arteries are the arteries that mainly bring blood to the brain. And people who have peripheral vascular disease or coronary artery disease have a higher chance or likelihood of having a blocked artery to the brain. And if it gone unnoticed, it can result in a mini stroke or a full-fledged stroke.
How can I find out if my carotid artery is blocked?
Again, a carotid artery can be tested very simply in a doctor's office without requiring invasive methods. The first way is for your primary care physician to listen to your neck with a stethoscope. If he hears a noise or what we call a bruit, then this may be an indication that the patient has blockage of the carotid artery. If there is no bruit, it doesn't mean it does not exist. To go a step further, and if the patient has multiple risk factors that include smoking, diabetes, coronary artery disease, high blood pressure, high cholesterol, obesity, old age, these are all risk factors, then the patient is at a higher risk of having coronary artery disease. And the second way of testing it, or the next step of testing it, is by a very simple ultrasound to the neck. The same way ultrasounds are done to check for babies.
And if the disease is discovered, how is it treated? What is the treatment?
The disease, if there is a disease discovered, it doesn't mean that it requires treatment. It requires treatment only if it reaches a certain level. If the patient has had symptoms, which is a mini stroke or a stroke, then the blocked artery needs to be fixed with an operation if it reaches a certain level, which is around 70% blockage. Now, it doesn't mean that we do not fix patients who have asymptomatic disease. It means even if we discover it and the patient has had absolutely no symptoms, going back to stroke prevention, if the blockage is above 80%, we would still recommend opening up the artery to prevent a stroke. That's one way of preventing a stroke. Apart from other ways of preventing a stroke, of course, the conservative measures, lifestyle changes, aspirin, walking, exercises, diet, medication for diabetes and medication for cholesterol, and so on and so forth.
And as far as the treatment, if it does require surgical intervention and opening up the artery, you were one of the first to do a carotid stent here in Southern California. Is that a better way, an easier way?
Carotid artery, the standard still, or the gold standard for treating carotid artery disease today in the literature and according to the government is still the surgical approach, is to open up the artery, clean up the artery, and fixing the artery. It's a very simple operation. In general, it takes 1 hour. Patient goes home the next day. Now there is a newer method that came to to life in the recent past, and this is going through the groin, going all the way up to the neck and deploying a stent in the carotid artery. As of today, the government has only allowed this approach in only 3 indications, because still the deployment of the stent has a little bit of a higher risk of a stroke during the procedure than surgery. Up till today, surgery is still a safer operation. However, in these 3 indications where you have patients who have had surgery and the disease has come back, stent is better. If you have had patients who have had cancer to the head and neck, you don't want to cut over these necks because it is difficult if they have had cancer and radiation therapy. So it's better for these people to undergo a stent And if patients have severe heart disease or lung disease that they cannot that they cannot be put to sleep for this operation, a stent is better for these people.